once you have diagnosed it as thymoma, it has to be treated. I would like to reiterate here that there is no role of waiting conservative management for thymoma. Once you have diagnosed it as thymoma, it's an invasive tumor, it's got to be treated. And the treatment is mainly in the form of surgery. Additional treatments available are chemotherapy and radiotherapy, and these days we tend to use what is called multimodality therapy for these patients. That means we use surgery, chemotherapy and radiotherapy in combinations. I must say here that the primary modality of treatment for thymoma patients is surgery, which means complete removal of the tumor. Thymoma is one of those tumors in the chest which can have a very long survival if it is treated adequately and completely. And a large number of studies across the world have shown that the single most important factor which determines the long-term survival is completeness of the operation. So when the surgeon operates, he's got to remove the whole tumor, any structure which it might be involving, like pericardium, like the phrenic nerve, like the lung, or any other structures. So we have to do what is called a very wide excision to remove the whole block of tissue, leaving no visible tumor tissue behind, what we call R0 resection. If you can achieve an R0 resection, it provides the patient best chance of cure. Now, every tumor that we remove, we always send it for biopsy, in which the pathologist will then tell us what type of tumor it is, whether it is a mild variety of tumor or a very aggressive variety of tumor, and based on that we take further decisions whether we need to give post-operative radiotherapy or chemotherapy to these patients to decrease the chances of recurrence in the future. When it comes to surgery for thymoma, there are 4 methods by which the surgery can be done. Mind you, the surgery is the same or has to be the same, but the methods of doing surgery are 4. Conventionally, this procedure has been done by what is called open method or sternotomy method. That's one. It can also be done from the neck by giving a horizontal cut in the neck, what is called transcervical approach, which is something very rarely used for thymoma now because it gives you very limited access and most of the cases cannot be done. Then there was a procedure called VATS or video assisted thoracoscopic method, in which 3 holes are made on one side or both the sides of the chest. A telescope is put, you get a 2D image on the TV, and you put instruments and hold the instruments with your hands and carry out the procedure. That's called video assisted or VATS method. And the latest addition is that same 3 holes, but instead of conventional instruments and telescope, you put a specialized telescope which gives you, the surgeon, 3-dimensional high definition vision, giving you vision as good or even better than open surgery, and you put specialized instruments which actually mimic the movements of your hands, and you carry out the entire procedure using these complex specialized instruments. Now this is called robotic. So open method, transcervical method, video assisted or VATS method, and robotic. These are the 4 methods by which the surgery can be done.